Are you feeling testicular pain and don't know whether you should worry or if it's something that will go away on its own? Did this pain start suddenly or has it been bothering you for days? Is it accompanied by swelling, redness, or fever? If you're watching this video right now, you're probably concerned and looking for answers. And you are in the right place, because in the next few minutes, I will explain exactly which types of testicular pain are medical emergencies, which ones can be treated more calmly, and most importantly, what to do in each situation to protect your health and fertility. I'm Dr. Amelia Tiller, and here on Male Secret 60 Plus, we talk openly about everything that affects the health of the mature man. Stay with me until the end, because the information you are about to receive can literally save your testicles and your ability to live a normal, healthy life. Before we begin discussing specific causes, I need to make something very clear. The testicles are extremely sensitive and important organs. They not only produce sperm, but they are also responsible for producing testosterone, the male hormone essential for your energy, motivation, muscle mass, bone health, libido, and overall well-being. Any problem in the testicles, if not treated properly and in time, can have serious and even irreversible consequences. That's why testicular pain should never be ignored or minimized. Testicular pain can appear in different ways, and each type of pain may indicate a different cause. Some men describe it as a sharp, intense pain that suddenly appears and is almost unbearable. Others feel a dull, constant ache that gradually worsens over hours or days. Some describe a feeling of heaviness or pressure in the scrotum, as if something is pulling downward. In some cases, the pain is not exactly in the testicles, but around the area, in the lower abdomen, groin, or even the back, but originates from the testicles. And there are situations where, in addition to pain, there is visible swelling, redness, warmth in the scrotal skin, or fever and nausea. Each of these patterns can indicate a different condition, and it is essential that you pay attention to the details. Did the pain start suddenly or gradually? Is it constant or does it come and go? Does it worsen with movement or touch? Does it improve when you lie down or elevate the scrotum? Are there any other symptoms? Did you experience any trauma to the area? Do you have fever? Did you notice any visual changes such as size differences, color changes, or lumps? All these details are crucial to determine the severity and urgency of the situation. Let's begin with the most serious medical emergency related to the testicles, testicular torsion. This is a condition in which the testicle twists around the spermatic cord, cutting off its blood supply. When that happens, the testicle begins to die due to lack of oxygen. Testicular torsion causes sudden, intense, unbearable pain, usually on one side. The affected testicle sits higher than the other, swelling develops quickly, and nausea and vomiting may occur due to the intensity of the pain. This is an absolute emergency. If it is not treated within 6 hours, the testicle can die and may need to be removed. Even with quick treatment, the longer you wait, the greater the risk of permanent damage. Testicular torsion is more common in teenagers and young men, but it can happen at any age. Sometimes it occurs after trauma, but many times it happens spontaneously, even during sleep. Some men have an anatomical predisposition that makes the testicles more mobile inside the scrotum, increasing the risk of torsion. If you or someone near you experiences sudden, intense testicular pain, do not waste time with home remedies or waiting to see if it improves. Go to the emergency room immediately. The treatment is urgent surgery to untwist the testicle and secure it in place to prevent recurrence. Usually, the surgeon also secures the other testicle, because if one torsed, the other is at risk. Another important and potentially serious cause of testicular pain is epididymitis, which is the inflammation of the epididymis, the coiled tube behind each testicle that stores and transports sperm. When it becomes inflamed, pain usually develops gradually over hours or days, accompanied by swelling behind the testicle. There may also be redness, warmth, painful urination, urethral discharge, fever, and general discomfort. Epididymitis can be caused by bacterial infections, including sexually transmitted infections such as chlamydia and gonorrhea in younger men, or by urinary tract bacteria in older men. It can also be caused by urine refluxing into the epididymis, especially in men with prostate issues. Epididymitis must be treated promptly with antibiotics, anti-inflammatories, rest, scrotal elevation, and cold compresses. If untreated, it can progress to an abscess, spread to the testicle, causing epididymo-orchitis, cause infertility due to obstruction, or become chronic, leading to persistent pain for months or years. So even though it is not as emergent as torsion, it still requires quick medical attention, ideally within 1 to 2 days from onset. Orchitis, the inflammation of the testicle itself, often occurs together with epididymitis, forming epididymo-orchitis. It can also occur alone, particularly in viral infections such as mumps. Although mumps is known for causing swelling in the salivary glands, in about 20 to 30% of post-puberty male cases, the virus also affects the testicles. Orchitis caused by mumps leads to pain, significant swelling, and may result in testicular atrophy or infertility if both testicles are affected. Fortunately, with vaccination, mumps has become less common, but it still occurs. Trauma is another frequent cause of testicular pain. The testicles are relatively exposed and lack true protection, which makes them vulnerable to injury. A mild trauma may cause strong pain that improves in minutes or hours, but more serious trauma can cause internal bleeding, rupture of the testicular membrane, or even rupture of the testicular tissue itself. If pain does not improve after trauma, or if swelling, severe bruising, or worsening symptoms occur, medical evaluation is needed. An ultrasound may be required to assess structural damage. Inguinal hernias may also cause pain that radiates to the testicles. A hernia occurs when a portion of the intestine or abdominal fat pushes through a weak spot in the abdominal wall and descends into the groin or scrotum. This can produce a bulge accompanied by pain or pressure. While not always an emergency, a hernia can become one if it becomes incarcerated or strangulated, cutting off its blood supply, which requires immediate surgery. Varicocele, hydrocele, spermatocele, testicular tumors, kidney stones, prostatitis, neuropathy, and even chronic pelvic pain syndrome are all potential sources of testicular pain, each with its own pattern, risks, and treatments. A hydrocele is the accumulation of fluid around the testicle, inside the membranes that surround it. This causes painless or mildly painful swelling, which may vary in size, sometimes larger during the day and smaller in the morning. Hydroceles can be congenital or develop after trauma, infection, or surgery. Small hydroceles usually cause no problems, but large ones can create discomfort due to weight and volume. Even if it doesn't hurt, any new swelling in the scrotum should be evaluated by a doctor to rule out more serious conditions. A spermatocele is a benign cyst that forms in the epididymis, containing fluid and sperm cells. It is usually small, painless, and discovered during a self-exam or routine checkup. Most require no treatment unless they grow large or cause discomfort, in which case they can be surgically removed. Testicular tumors are a less common but extremely important cause of testicular pain. Testicular cancer is the most common cancer in young men between ages 15 and 35, although it can occur at any age. The typical symptom is a hard, painless lump in the testicle, but some tumors can cause pain or a feeling of heaviness. Any lump or hard area should be evaluated immediately. The good news is that testicular cancer, when detected early, has a cure rate above 95%. Treatment usually includes surgical removal of the affected testicle and, depending on the stage, chemotherapy or radiotherapy. This is why self-examination is so important. Every man should check his testicles monthly. Kidney stones can cause pain that radiates to the testicles. As a stone moves down the ureter, it may cause severe flank or back pain that radiates toward the groin and testicles. This pain is extremely intense, often comes in waves, and may be accompanied by nausea, vomiting, and blood in the urine. Medical evaluation is necessary, as some stones pass naturally while others require intervention. Urinary tract infections, including bladder or prostate infections, can also cause testicular pain. Prostatitis, in particular, may cause pelvic pain, perineal pain, and testicular discomfort, along with urinary symptoms such as burning, frequency, and urgency. Neuropathy or nerve damage can cause chronic testicular pain with no obvious cause. This may happen after surgeries, such as hernia repair or vasectomy, from poorly controlled diabetes, or from nerve compression in the lumbar spine. Neuropathic pain often feels like burning, tingling, or electric shocks. Chronic pelvic pain syndrome can also include testicular pain. It is a complex condition involving muscle tension in the pelvic floor, low-grade inflammation, neurological issues, and psychological components. Treatment may include pelvic physiotherapy, medications, therapy, and lifestyle changes. Vasectomy can cause pain in some men. Acute postoperative pain is expected and improves within days, but 1 to 2% of men develop chronic post-vasectomy pain caused by congestion, sperm granulomas, or nerve injury. Persistent pain after vasectomy should be evaluated by a urologist. Now that you understand the main causes of testicular pain, let's discuss when it is an emergency and when you can wait before seeking help. Go to the emergency room immediately if you have sudden, intense testicular pain, especially with nausea or vomiting. A testicle that looks higher or different from the other. Fever, chills, redness, or rapidly increasing swelling. Significant trauma with persistent or worsening pain. Blood in the urine, severe abdominal pain, or inability to urinate. On the other hand, if you have mild to moderate pain that started gradually and is not accompanied by alarming symptoms, you can schedule a urologist appointment within the next few days. While waiting, you may use comfort measures: rest, scrotal elevation, cold compresses for 15 to 20 minutes, avoiding activities that worsen pain, pain relievers like acetaminophen or ibuprofen, but even mild pain should not be ignored. If it doesn't improve, worsens, or new symptoms arise, seek medical attention. When you see a doctor, they will take a detailed history and perform a physical exam checking the scrotum, testicles, epididymis, spermatic cord, and groin area. They will look for sensitivity, masses, swelling, and specific signs. One important test is the cremasteric reflex. Normally, stroking the inner thigh causes the testicle to rise slightly. In testicular torsion, this reflex is usually absent. Another is Pren's sign. Lifting the testicle often relieves pain in epididymitis, but not in torsion. Ultrasound with Doppler is essential for evaluating blood flow and anatomy. Urine tests, blood tests, and tumor markers may also be ordered depending on the suspected diagnosis. Treatment depends entirely on the cause, from emergency surgery for torsion to antibiotics for infection to supportive therapy for viral causes to surgical repair for hernias or trauma, and so on. It is important to acknowledge the emotional toll that testicular pain or testicular-related diagnoses can cause. The testicles are strongly connected to male identity, virility, and fertility. Problems in this area often trigger anxiety, fear, and shame, causing many men to avoid seeking help. If a testicle must be removed due to cancer or another condition, know that it is entirely possible to live a normal, healthy life with just one testicle. One testicle can produce all the testosterone and sperm necessary for normal function. Testicular prostheses also exist for aesthetic purposes if desired. Communication with your partner is crucial. Silence and avoidance only create distance. Therapy can also be helpful in addressing emotional stress. Now let's talk about prevention. Use protection during sports to avoid trauma. Practice safe sex to prevent infections. Perform monthly testicular self-exams. Get vaccinated against mumps. Maintain good hygiene and hydration. Treat urinary infections promptly. Manage chronic conditions like diabetes. Avoid prolonged heat exposure. Wear appropriate clothing during cycling. Avoid excessively tight underwear. Maintain a healthy weight. I also want to share some real patient stories to illustrate the importance of timely medical care. These real cases show the importance of immediate evaluation for sudden symptoms, timely assessment for persistent symptoms, and early detection through regular self-exams. Let's address a few myths. Myth number 1. If the pain isn't unbearable, it's not serious. False. Many serious conditions start with mild pain. Myth number 2, if pain improves with analgesics, I'm fine. False. Painkillers don't treat the underlying cause. Myth number 3, testicular problems only happen to young men. False. They can occur at any age. Myth number 4, losing one testicle makes you less of a man. Completely false. One testicle is enough for normal hormonal and reproductive function. Finally, know your own body. Regular self-exams allow you to detect changes early. Examine each testicle separately after a warm shower when the scrotum is relaxed. If this video helped you, please like and share it. Your engagement helps this information reach men who may be suffering in silence. Subscribe to Male Secret 60+ and activate notifications for more content about men's health. Thank you for watching. Take care of yourself. Your health is your greatest asset.